We went from no over-the-counter tests in January to 46 million in October, 100 million in November, and almost 200 million in December. But it's not enough. It's clearly not enough. If we'd known, we would have gone harder, quicker if we could have. Because steps we have to take to increase the number of authorized tests, we're now able to purchase 500 million at-home rapid tests to be sent to the American people for free when they request it. And we're going to continue to use the Defense Production Act to produce as many tests as possible. And starting in 2 weeks, private insurance will reimburse you for the cost of at-home tests. We're providing access to free tests for folks who don't have insurance. But we have to do more. We have to do better, and we will. We've already deployed emergency response teams in Colorado, Michigan, Minnesota, Vermont, New Hampshire, and New Mexico. Things are better, but we do know that with the rising cases, we still have tens of millions of unvaccinated people, and we're seeing hospitalizations rise. It means our hospitals in some places are going to get overrun, but in terms of equipment, both in terms of equipment and staff. That's why we stockpiled and pre-positioned millions of gowns, gloves, masks, and ventilators. We're mobilizing an additional 1,000 military doctors and nurses and medics to help staff hospitals. FEMA is deploying hundreds of ambulances and EMS crews to transport patients. We've already deployed emergency response teams in Colorado, Michigan, Minnesota, Vermont, New Hampshire, and New Mexico. We're ready to provide more hospital beds as well. The bottom line is we want to assure the American people that we're prepared. We know what it takes. And as this group of bipartisan governors has shown, we're going to get through it by working together. And we're seeing hospitalizations rise. It means our hospitals in some places are going to get overrun, but in terms of equipment, both in terms of equipment and staff.